Dental anxiety journeymen and women, journeymen and journeywomen, welcome to your sanctuary. This is a safe space. This is a calm place. This is a gentle place. ASMR, ASMR. A couple little plastic teeth. We can see what those sound like. ASMR. YouTube. ASMR. YouTube. Can you guys tell that this is the area where my microphone is recording? A couple little plastic teeth. ASMR. YouTube. ASMR. Are you guys feeling relaxed yet? Is this relaxing? Is this calming you down for your dental appointment? So today we're going to be using ASMR, whatever that is. I don't even know what that is. Something to do with like sounds to calm you down. I don't know. Welcome to your dental anxiety sanctuary. Today we're going to be learning how to hit your dentist in the face with a frying pan when he tries to get inside your mouth. Now, guys, I'm just joking. We're not gonna hit anyone in the head with a frying pan. Although I will say I did accidentally actually hit myself in my temple with this frying pan before the cameras were rolling earlier as I was practicing my frying pan routine for this video. So a dentist did get hit in the face with a frying pan for the making of this video. I don't think that's a very pleasant sound, is it? You want to have PTSD flashbacks to the sound of a dental drill? I can do that for you. Pretty horrifying. If you actually have PTSD from listening to dental drills, you're probably going to want to skip this part of the video because it doesn't sound good. All right, there's your warning. 3, 2, 1. All right, so what's the point of this video? Well, a lot of people are scared of the dentist. There's a lot of valid reasons for that. You know, I had a patient who told me that he goes, I've had cancer and rabies, and this toothache is worse than cancer and rabies. That sounds kind of scary, right? And, you know, people like me, dentists, we're weird and scary. How do we overcome these things? What can we do about all this dental fear and dental anxiety to make it easier for patients like you to get dental care when you need it? Well, for one, I've found that a lot of patients that I talk to really don't know what their options are for sedation for dental treatment. You know, what's nitrous oxide? What's IV sedation? What's oral sedation? What do you mean I'm not going to be all the way asleep? Wait, there's different types of IV sedation? What does all of this mean? What does it mean for me? What is the appointment going to look like for me? How much is it going to cost? Why is it this way? Why is it that way? People don't know the answers to these questions, and there's no reason you should because you've never had to do any of this before. But I think understanding these different sedation techniques that dentists can use to try to help you reduce your anxiety for an appointment is going to help you gain confidence that then you can schedule a consultation with a dentist in your area, that you'll be able to get the dental care that you would need. So I wanted to make a video that would explain the differences between the different types of dental sedation available so that you might have a little bit more confidence going into a dental appointment. Hopefully it'll help you get scheduled with a dentist sooner so that you can stop panicking about whether or not your teeth are a total train wreck and you have to have everything in your mouth fixed. Hint, usually they're not, right? I see a lot of patients who haven't been in to see the dentist in years and they're really scared. They're like, oh my gosh, every single tooth is going to have a problem. I'm never going to be able to recover from this. It's going to be awful, blah, 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 blah. And a lot of times it's more manageable than you think, right? Sometimes there is a lot of work that needs to be done. Either way, it's better to take a look at things sooner than later so you can figure out what are my options here? What are the steps I can take to try to, recover from this, improve my dental health, improve my smile, avoid pain down the road. Sooner is still better than later, no matter where you are on the spectrum of dental treatment needs. Also, even if you don't go in to see a dentist right away, I have other videos on my channel that explain how to avoid ever developing dental problems in the first place, right? There's so many things you can do, simple things, little habits throughout each day that are going to prevent you from having dental problems. And in my opinion, preventative medicine is the best medicine, all right? I want to get everybody on the preventative medicine train so that you don't have to go in for a big dental treatment appointment where you have to do all these sedation appointments and everything. It's okay if you need to do sedation appointments and get a lot of dental treatment done, but I want to help people avoid that too if possible because, it does get expensive. Okay, so before we even get into the nitty-gritty of talking about the different sedation methods in dentistry, let's talk about anxiety and fear reduction tool number 1. Having a kick-butt awesome bedside manner, or from your perspective as a patient, being comfortable with your specific dental care provider. I was terrible at this when I started working as a dentist. Just bad. Just boo! Quite honestly, I did not have the skills to understand what was going on with fearful, anxious dental patients when I started in practice. I was clueless. I was never scared of the dentist myself. That was not part of my experience. I sort of saw it on TV as like a stereotype thing, but it was kind of like far away, like it wasn't part of my reality. I didn't get it. It turns out this is super common, okay? If you get scared going to the dentist, if you can't even think about going to the dentist and you haven't been in 10, 15, 20, 25 years, that's very common. You're not alone. Tons of people have this fear. It is normal, it's common, but there are also ways to work through it, okay? You don't have to let the fear be completely paralyzing. There's ways to work through it. But again, I didn't really know any of this, which sounds crazy because you're like, you were a dentist. How did you not know? I didn't know. And if you don't know how to comfort patients who have dental anxiety and help them relax and become more comfortable, and you don't understand what's going on with them emotionally, you can very quickly end up with a very, very upset patient who you understand even less. You're just like sitting there confused, like, why is this person yelling at me? I don't get it. There was a lot of that. There was a lot of people getting very angry at me when I first started working as a dentist. There was a lot of stress on my end with my job, just trying to do my job correctly. I was spending hours and hours and hours on the weekends trying to learn everything I could about how to take care of patients that I'd never really been taught in dental school. Basically, it was a big mess for a while. Not really a fun time. But thankfully, I've had a lot more practice at this. I've done a lot more research on methods of helping patients get relaxed, get comfortable, be set at ease in a dental environment. And I've gotten way better at having those conversations with patients and being more in tune with what's happening with people emotionally. I've actually had a lot of patients who thought that they were going to need sedation for dental procedures, and after I just kind of talked them through things, answered questions, helped them calm down, they got to know me a little bit, they were able to take care of their dental work with just local anesthetic, right? Just being numb. And it really wasn't a big deal. And they're like, oh, wow, this is like the most comfortable I've ever been in a dental office. It's like, that's the crazy thing, is it doesn't take that much once you know what's going on to just set people at ease. But, if you don't know the basics of why they're not at ease and how to, address those factors, you're just going to have an anxious person there sitting there scared, not talking to you about what's freaking them out right now, So much of it has to do with just making sure that the patient is in control of the situation at all times, right? Being in a dental chair, it feels very vulnerable. You feel like you don't have a lot of agency. You're laying down, there's people reaching in your mouth. It's a weird situation to be in. And just making sure that, patients know at any point during any procedure, they raise their hand. I stop what I'm doing immediately. We take a break. We talk things over. That puts so many people at ease. And like, once you do that and they know, oh, he's not lying to me, like I am in control of this situation, that helps a lot of people a lot. Just making sure that things are happening at the patient's pace, taking breaks if their jaw's getting tired, if they just need a break because they're having a little panic attack, whatever, you just stop. You just take a break. They know that they are in control and that the rate at which they get their care taken care of is in their hands. That's important. Slow and steady wins the race, as they say. There's a lot of pressure in modern healthcare to rush patients through the system, right? Completing procedures, because it's a business run on short-term quarterly profit goals instead of long-term, sustainable health of the patient being the main goal of the business, right? So there's a conflict of interest there oftentimes. And, I think that's a big contributing factor to a lot of fear and anxiety for patients in the dental care system, because they just don't know what's going on as they're getting rushed and shuffled through this system. And that just contributes to their anxiety about what's happening. People fear the unknown. That's part of why I'm starting this YouTube channel, is because I can spend the time making these YouTube videos and there's nobody waiting in the waiting room that I gotta hurry up through this patient to get to the next patient, and I gotta hurry and try and answer questions for this person, and then I gotta hurry and try and answer questions for this person. Here, I can take my time. You guys can ask questions in the comments. I can address those. Then I can put a video up that's permanent and you can reference it whenever you feel like it. I'm trying to fill some of those gaps in the healthcare system to help people be more confident about the care that they're receiving. I know a lot about dentistry, right? I know how to make things look good and function well. I know how to prevent problems, but I haven't always really known how to communicate that in a simple and convincing way to patients, right? That's always been the problem. I've gotten better, but I still need a lot of work. So that's kind of why I'm playing with this whole YouTube thing, because I'm trying to figure out, okay, how can I communicate better with patients? So much of dentistry has to do with body language and listening skills. Just on a very basic level, lots of people have a very significant fear of just laying down in a dental chair, right? It's a vulnerable position. It's weird. You're laid back, you're almost upside down, your mouth's open, people are reaching in there, you can't talk, you can't move. It's kind of freaky. So much of meeting new patients and helping them get comfortable has to do with, sitting down with them at eye level, right? Being on the same plane. You create a weird subconscious power dynamic when, the dentist is standing up and the patient's like halfway back in the chair already. And it just doesn't, it's not a good vibe, right? You need to sit down, you got to look them in the eye, listen to them patiently. A lot of these patients have had significant negative experiences in the past, and they want to express that to their new dentist so that they don't have a repeat of those bad experiences, right? So you need to have that exchange with whoever your dentist is at the outset of treatment, and don't be afraid to have that conversation, right? You need to and should want to have that conversation. And if they don't sit there and listen to you and, talk to you in a way that feels empathetic and understanding, then, probably need to shop around for a different fit for you. And that's fine. There's no problem with that. I'm not the right fit for lots of patients. And again, especially when I first started working as a dentist, I wasn't clued into any of this. I was on my feet all the time, running around from room to room, trying to get from patient to patient, because everybody, I was needed over here, and it's like, okay, what's going on with you? All right, what can I do to fix that? Okay, what's going on with you? What can I do to fix that? Problem is even though you're trying to help people and your brain is working a mile a minute trying to figure out how to do that, the patient doesn't understand that. And so they're just like, all they see is a person standing up and going back and forth from room to room. They don't understand that you're doing this because you're trying to help them, right? It just turns out that trying to see too many people too fast is just a really bad strategy for helping anyone at all. That's the bottom line of one of the things I've learned with all of this. And, you can be efficient, right? You can be efficient. You have to be efficient, but you cannot rush. You have to take the appropriate amount of time to help a patient actually feel cared for, or chances are there's just going to be a bad experience at some point. You have to make sure that you take time to repeat statements back to patients and give them opportunities to ask questions. Just because I say something and I think that what I said makes sense doesn't mean they understood any of it, right? That has been a humbling experience, realizing when I was like, I thought I said the words I needed to say, and then they're like, none of that made any sense at all. And I'm like, okay, let me figure out different words. We're going to try round 2 or round 3 or round 4 until we understand what's going on here. I've had to slow down a lot when I'm talking to patients. I talk at half speed a lot of the times when I'm trying to explain something to a patient so that they feel comfortable. Luckily, you can rewind these videos, right? I can blah, 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 and you can go, what did he say? And you can watch it again. Can't really do that in real life. And really, if something isn't making sense when you're talking to a healthcare provider, please, please, please tell them that it doesn't make sense. That's important. That I never judge a patient and go, well, you should understand what I'm saying now. No, it's like, it's my fault for not explaining it in a way that you can understand, right? I need to meet you. I don't expect you to understand dentistry the way I understand dentistry, right? And I try very hard to not explain dentistry the way that I understand dentistry. I try to use layman's terms, but so much of alleviating anxiety is really understanding, okay, this is what this person is saying is going to happen, why it's going to happen, what it's going to feel like, what the experience is going to be like for me, etc. So if you're not understanding those things, do speak up. I've also found it's really important to use the right tone of voice, right? You've kind of got to be calming. You've got to be soothing. You got to be softer. You don't want to, you can't talk too fast. You can't talk too loud. You gotta be soft, reassuring tone of voice. Everything's gonna be fine. We're gonna get through this. You got this. Positive encouragement. Positive encouragement. Basically, you have to demonstrate through your actions that you actually care about a patient. And that seems like a duh, like duh, of course. It seems like that. But sometimes you think you're doing that and you're not really doing that, right? And so and you're like, I know most of the people watching this are going to be patients, dental patients, and you're like, this guy seems like he's saying a lot of stuff that's more directed toward dental care providers, but I'm just trying to help you understand what's happening on the other side of things, because ultimately this is about bridging communication barriers, right? So it's helping the patient side understand the healthcare provider side, and the healthcare provider side understand the patient side, so there's less communication friction and disruptive communication that is messing up our ability to, serve each other and take care of each other. And it goes both ways, right? Everybody's in this, got to be in it together, got to be trying to get to a positive outcome for the whole group, right? That's the goal. Step 1 to alleviating dental anxiety, breaking down communication barriers. So just make sure that whatever dentist you're working with, that you have a good vibe with them, that you feel like you're communicating well. Make sure that you feel like you're communicating well with your dental care provider from the outset, right? If there's a communication barrier when you start treatment, things probably aren't going to get better as you go through it. So just, if you've got a bad vibe with somebody, you don't have to have that person be the person that works with you. I'm positive that I have plenty of patients out there who hate my freaking guts and never want to see me again, right? And that wasn't because I didn't try my best to help them. It just was, look, we weren't a good fit. I wasn't who they wanted. And that's fine. That's totally normal. You should pick someone who you're going to work well with and be comfortable with, and that's going to make everything go so much smoother and better, right? For everybody involved. It's just better to figure out that you're not a good fit for each other before you start doing little surgeries together, right? That's just word to the wise. So dental anxiety is real and valid. You should not feel like you're going to be judged going into a dental office for having this issue. It's totally common and it can be addressed. Just make sure that you're, looking around for the right dental provider for you. I think one of the best ways to do that is just talking to friends and family, right? I mean, you can read reviews online too. Obviously, we have that these days. Sometimes, I don't know, I trust advice from friends and family on their actual experiences with a healthcare provider or a dentist more so than I would online reviews. Definitely take online reviews into account as well. And then just, go off your first person experience with the person when you meet them and talk to them. Just be thinking like, is this person listening to me? Are they hearing what I'm saying? Do they have the same goals for my care that I do? And if the answer to those questions are yes, you're probably going to have a good experience with this, dental provider. Hopefully all of that made some sense and gave you some ideas, some things to be thinking about. If you're a person who hasn't been to the dentist in a long time, trying to figure out, okay, who would be the best dentist for me to go to? But yeah, now let's get to the good stuff, right? Some people really do need to be sedated for dental treatment, right? That's what they need. Having, a good relationship with their dental provider is great, but when the drill meets the tooth, it's like, I don't want to be awake for that. Sedation could help. And it makes sense, let's be honest. People don't have a whole lot of other medical procedures without being sedated, right? Honestly, it's kind of weird that dentistry is as casual as it is, just like, all right, open your mouth, let's do this thing. It's just, I don't know, but whatever. That's the tradition, I guess. Sedative number 1, nitrous oxide. Lay people know this one as whippets. You should not do whippets. Laughing gas in a dental setting, much more controlled, appropriately administered. Whippets. Whip pets. That's kind of a violent word if you separate it into 2 words, right? Whip pets. Don't whip your pets. Don't do whippets and whip your pets. Bad idea. Did you know there's a dog called a whippet? I did. I Googled whippet to double check the spelling and it pulled up a picture of a dog. So don't do whippets while whipping your whippet. More specific, pet. Still a bad idea. Is this guy on nitrous right now? I'll never tell. No, for legal purposes, I am very, very sober right now. But also, is it illegal for me to film YouTube videos while drunk? I don't know that it is. No, I actually don't even drink. I'm a very boring, unfun person. What did you expect? I'm a dentist, duh. We aren't real people with addiction issues like everyone else on the planet. Whip it. Whip it good. Nitrous oxide, laughing gas, controlled whippets. Who is that for in a dental setting? Nitrous oxide is for patients with mild anxiety, right? You don't have dental PTSD, right? And I say that sincerely because there's lots of people who have PTSD, post-traumatic stress disorder, from a bad dental experience, okay? It's not really that uncommon. There's patients who, they walk into the dental office, their heart starts pounding like a jackrabbit, they're sweating, they have no conscious control over this at all. Their head's jerking away before you even touch them, and they're apologizing for that. They're crying, And you don't have to apologize for any of this, by the way. You don't have to apologize for crying. Cry away. It's totally fine. That helps you de-stress, helps you calm down. We'll get you some tissues, you know what I mean? Like, that's fine. But yeah, nitrous oxide is not going to be the ticket for that type of patient. If that's you, you're going to need something stronger than nitrous. Nitrous is for patients who just kind of get the heebie-jeebies from dentistry, right? It's just kind of like, I don't want to do this. You just don't like it. It's weird. You don't like the noises. You're the type of patient who's never really had a particularly bad dental experience, but how good can a dental experience be, really, right? That's your perspective. Like, even if it goes perfectly, you'd rather not have someone's hands in your mouth. You just need a little something to take the edge off, right? That's what nitrous is for. Personally, I also always use nitrous for kids. I never work on kids without nitrous. In my opinion, it just makes everything run so much smoother. They have a way better experience. It's not a big deal for them. Just helps them relax. I really don't want to be the dentist who causes a kid to have a bad dental experience and then they're afraid of the dentist for the rest of their life. I want to minimize the chance that that's ever me doing that. So I use nitrous whenever I'm working on kids. There's plenty of dentists who are better at working on kids than I am, and maybe they don't want to use nitrous or don't need it, and that's totally cool too. Whatever you feel comfortable with as a parent. Nitrous is super safe. It's in and out of their system really quick. It's great for working on kids, in my opinion. That is the other cool thing about nitrous is after the appointment, it's in and out of your system right away, right? You basically flush out your lungs with 100% oxygen for 5 minutes after the nitrous has been administered. You get it all out of your bloodstream, out of your system, and the sedative effect is completely gone. So you can drive yourself home, not if you're a child, obviously, but if you're of legal driving age, you can drive yourself home. There's no residual sedation. Pretty cool. The weird thing about nitrous, too, is we actually don't even fully understand the biochemical mechanism by which it sedates people, which is weird, but it works, and we've been doing it for a long time, so it's safe. No, it's safe. It's fine. Magic gas. There usually is going to be some kind of an extra fee for nitrous oxide associated with a dental appointment. Unfortunately, the companies that provide us with the nitrous and oxygen tanks just won't give us the darn things for free, so one of these days. So there is a little bit of an extra fee when you're using nitrous oxide with a dental appointment, but it's going to be the least expensive of your sedation options. It's the least effective, but it's also the least expensive. It has the least side effects. It's the safest, it's the easiest, and it is going to work and help some patients. I'm also going to throw in headphones and stress balls for patients who have mild dental anxiety, right? Bring your headphones, bring a stress ball, just stuff to distract you. Take your mind off of what's going on. Find an office that has TVs, in the dental office. I think that's a great distraction. This is the one time I'm going to encourage you to consume television in mass quantities at your dental appointments. If you want to pull me up on YouTube and watch me at your dental appointment, no, don't do that. That'll just creep you out. And the other thing is just slowing your breathing down, right? If you're starting to get anxious, your chest is tightening up, you're feeling a little bit like, I got to get out of here. Just slow your breathing down. Slow, deep breaths in through your nose. I don't know why I just touched my nose there. That was kind of weird. No, slow, deep breaths in through your nose, just very calmly, very slowly. That can actually help decrease your heart rate, lower your blood pressure, just calm you down. Slow, diaphragmatic, nasal breathing while you're on the nitrous oxide, squeezing your stress ball, jamming out to your music on your headphones. That's sedation option number one to calm down at a dental appointment. You don't need to feel weird about doing any of this in a dental chair. Like, it's all totally cool, totally fine. I am all for you doing whatever you need to do to feel comfortable, because that's going to make it easier to get done what needs to get done in here and get in and out, and everybody's happy. I'm scared of heights, right? I watched that movie Free Solo with Alex Honnold, the climber who climbs up the mountains. This is my mountain climbing motion. Climbs up mountains with no rock climbing gear, right? He just does it freehand, and just like, if he falls, he dies. So like, I've been on some rock walls before and stuff, but if anybody tried to make me climb a rock wall without those rope thingies under my butt and crotch, like, I need those rope thingies under my butt and crotch, thank you very much. So it's totally fine for a dental appointment for you to need a little bit of nitrous, a little bit of stress ball, a little bit of headphones, a little bit of TV, right? That's all totally cool, normal, natural, fine. Okay, you're not a weirdo. All right. Sedation option number 2. Oral sedation. Oral? No. It just means pill, everybody. It just means pill. Oral sedation. This is where we give you a pill or two to take prior to and or during your dental appointment. This is typically a class of drugs called benzodiazepines. These are medications that have been used and tried as sleeping pills, although they aren't the most effective, and anti-anxiety medications. There's a bunch of different benzodiazepines. Benzodiazepines. These are generally quite safe if used appropriately for dental patients. You know, it's short-term use. They can have some nasty side effects and withdrawal problems if they're used chronically, but if you're just taking them every once in a while for a dental appointment, pretty low risk that you're going to have issues there. Obviously, you have to talk to your dentist, right? Not me, your dentist, about whether or not you're a candidate to take these medications. Everybody, has different things going on with their bodies. Everybody reacts a little bit differently to medications. You can't perfectly predict how people are going to sedate. Me, for patients, I typically start with the lowest recommended effective dose for a patient if it's the first time I'm using an oral sedative with them for a dental appointment, and we kind of just see how it goes. Most patients, it works pretty good. Some patients, they say they don't really feel it that much, but a lot of times I can end up doing the dental work and they don't really have a problem, even though they tell me, well, I didn't really feel that too much. So it seems to do a little something. And for those patients, we make a note, okay, maybe we can try a slightly higher dose for the next appointment if we need to do something else in the future. The other cool thing about oral sedation is if you don't quite feel it enough after you've taken the pill, we can kind of add a little nitrous oxide in on top of that, right? We can work those two together. You can utilize nitrous oxide along with a benzodiazepine, get a little bit of extra sedation, and you can kind of dial in the nitrous oxide dose in real time to figure out, okay, what's the sweet spot for this patient that they're going to be the most comfortable. Just sort of top you off with a little laughing gas, a little chuckle juice. I actually still remember getting put on nitrous oxide when they took my tonsils out as a kid. Apparently they don't do that as much anymore, but I don't know, they yanked mine out of there. They had me on nitrous oxide, and I still remember the nurse, she asked me if I wanted to hear a joke, and I said, oh yeah, sure. And then she leaned in really close, and she just goes, fish. Just said the word fish, and I just died laughing. I was like crying, laughing, like, what just happened? This is hilarious. And it was just the word fish. That was the whole joke. Anyway, I don't know. Maybe that's where my love of stand-up comedy was born. I'm not sure. It's my origin story. So with oral sedation and nitrous oxide, you are not completely under, right? You are still conscious. You are still breathing on your own. You're able to respond and talk with me. Some patients may doze off a little bit, but we wake you up and you say, hey, stop drooling. And you go, okay, I'll be better, or whatever, and we move on. You're still mostly present, mostly there. You do have to have someone drive you home from an oral sedation appointment at a dental office, okay? You are not okay to drive. You are not safe to hit the road, Jack, okay? That would be DUI territory. Boo, bad, not acceptable. But my dentist gave me these pills. He said, no. You're still getting arrested, okay? That's not all right. You're going to hurt yourself or somebody else out there. Not okay. Do not benzodiazepine and drive. Not okay. You need to follow your dentist's instructions on how to use these medications appropriately and how to behave for the next 24 to 72 hours to stay safe, okay? There are certain medications you cannot mix these with. Okay, narcotics, alcohol, all of these things are central nervous system depressants. If you take too much of them, your brainstem will forget to tell your lungs to do the whole breathing thing and you will suffocate, okay? It happened to Heath Ledger. It could happen to you, okay? Not good. Follow the instructions. So who is oral sedation for? This is for the dental patient who is a little leery about dentistry, is nervous about dentistry, has some dental anxiety, but who is comfortable with the dental staff who is going to be taking care of him and her. Him or her. Him and her. Whatever. You trust your dental care providers and you feel comfortable, but you just don't like the overall experience. Maybe you've had some bad dental experiences in the past. You need to be you need something to help you calm down, because despite your best efforts, you can't calm down on your own. You want to be a little more out of it. You want to have a less clear memory of the sights and sounds of the things that are happening, the things I'm doing at the entrance to your head. You can still handle the idea of dental work, but you could really do without the details. You're not the type of patient who's going to randomly panic, sit bolt upright in the chair, and sprint out of the dental office, right? You're confident that's not going to happen. You just want things to go a little bit smoother, right? Just smooth out the bumps, right? That's not so much to ask. Make time pass a little bit faster. Oral sedation, reasonable option for you. Sedation option number 3, IV conscious sedation. IV conscious sedation. This is for patients who really don't like me or people like me at all. All right. Dentistry has not been your friend. You do not have any dental memories that you look back on fondly and sigh and think, those were the days. Now, you break out in a cold sweat when you walk in the building. You have no control over these feelings. They are just how it is. You wish that wasn't how it is, but that's just the feeling you get in your guts, when you do anything or are involved with anything dental related. It's just fear, anxiety, anger, rage, pain, awfulness. Your brain just doesn't like dentistry, okay? IV conscious sedation is for you. You've had bad experiences and you don't think it's ever going to get better and you don't even want to try. The chance of you having a good relationship with dentistry, that ship sailed a long time ago, okay? IV conscious sedation. Also, IV conscious sedation can make sense, and I should say oral sedation can make sense if you're a patient who's just having a more invasive dental procedure that you've never had before. Most patients, if you're getting your wisdom teeth out, it's probably a good idea to be sedated. If you're having a more surgical procedure and you haven't had that kind of a dental procedure before, talk to your dentist. They may be like, yeah, you should probably be sedated for this. It is important to understand IV conscious sedation is not going to knock you unconscious. You're still going to be awake, right? A lot of patients don't realize that. They think they're coming in for a sedation appointment and they're like, well, that means I'm asleep, right? Not always. There's different levels of sedation that happen with an IV. I'm gonna knock you out. Mom said knock you out. It's not that. Conscious sedation. You are still awake. Mama said knock you out. You are breathing on your own. You're able to respond when people ask you questions, but you're still pretty out of it, all right? You're not going to be solving any Rubik's Cubes. You're in a little bit of a haze, a daze, a malaise, a little woozy, a little loopy. Dentistry, not going to so much be on your mind, right? You're not going to be like, I'm in a dental office right now. You're going to be like, not exactly like that, but something like that. You might start saying some stuff like people on those other YouTube videos you watch more than this one. I have talked to some surgeons who do sedation regularly, and they have pointed out that ever since those YouTube videos started coming out, they're getting a lot of patients who are acting out, like when they're on sedation, like way weirder than they ever normally would, just so their family members can film it and put it on the internet. So thanks for that, YouTube. You stupid, no good for nothing communication tool that doesn't help dentistry at all. No, I think YouTube has potential. Other cool thing about IV sedation, it has an amnesic quality to it, right? You're probably not going to remember very much from your dental appointment, right? I've never been blackout drunk, but as far as I can gather, it's kind of something like that, right? Your body's kind of doing things, but the lights aren't really on up top, which might be what you want if you don't want to remember anything about a dental appointment. Don't get blackout drunk before a dental appointment. That's not as predictable or safe. Don't do that. The other thing about IV sedation is that it is easier to get the exact right dosage of sedation for a particular patient, right? If you've struggled with oral sedation in the past, IV sedation might work better for you because with oral sedation, we max out at giving you 2 pills because we don't really know how much you're going to sedate if we were to give more pills than that. And we don't have an IV in, so we can't give you a reversal agent if we over sedate you with pills, right? With an IV, you can give another dose of the medication to try to sedate you more, and then if you over sedate, we can immediately give you a reversal agent to counteract that drug and bring you out of the sedation. So it's much safer, it's much more predictable, it's easier to, get the exact right dosage to the point where it's both safe and effective. Safe and effective. Good balance, right? Oral sedation is still very safe, but we go towards safety and maybe fall short of effectiveness because we don't want to over sedate. With IV sedation, you're hooked up to a pulse oximeter, you're getting your blood pressure monitored repeatedly, your heart rate, all these things are being watched. If any of that oxygenation levels, anything starts to drop below an acceptable level, give you a reversal agent through the IV to unsedate you. I don't know if that's the right word, but to de-sedate you. Now I'm just starting to sound stupid and you're like, this guy doesn't know what he's talking about anymore. Basically, if a patient starts to go too far towards Sleepy Town with an IV in, you can just give a reversal agent and bring them out of Sleepy Town. Very safe, very effective that way. So IV conscious sedation, you're more sedated than oral sedation, but it's very safe, it's very effective. Generally, this is a good option if you have significant dental anxiety. The other time that IV conscious sedation can be really useful is if you're a patient who has a hard time getting numb. Our anesthetics, our local anesthetics for numbing patients are pretty effective these days. Like, it's very rare that I have a hard time getting a patient all the way numb the way that I would need to. But every once in a while, every once in a blue moon, you get a patient who they just don't get numb, and that happens. Like, sometimes patients just don't get numb, or at least their teeth don't get numb. Sometimes their whole face, it's like, everything is numb, doc, except for this tooth that you need to work on. And it's like, well, all right, back to the drawing board. So in those cases, IV sedation can help us out from a pain relief standpoint as well. There's medications that can be given through the IV to help with that, in addition to the sedation, to make sure that an appointment is painless for a patient. Well, that all sounds great, doc. What's the downside to IV conscious sedation? Well, it is more expensive, right? There's a lot of time and energy and equipment and just training, attention to detail, and effort in implementation that goes into being able to provide IV sedation for patients. And so that raises the cost. But if that's the only way to take care of your dental needs, then it's got to be done, right? The other nice thing about IV sedation is because you're totally out of it and you don't really care about the fact you're in a dental chair right now, we can oftentimes do a lot of treatment all at once, assuming you need a lot of treatment. So it may only be an appointment or two, and you could really change a whole lot about the health of your mouth and your smile and everything else. Hopefully, after just an appointment or two, your teeth can make a lot of progress toward being healthy. So that's kind of cool, right? That's good. Sedation option number 4, general anesthesia. You're making us bring out the big guns. No, I'm just kidding. It's not a big deal. Some people need to be fully unconscious in order to have dental work completed. That's fine. That's cool. No big deal. NBD. General anesthesia. This is for you if you have tried IV conscious sedation and that still did not go very well, right? You still didn't sedate all the way. You were up and moving around in the chair and your body was doing crazy stuff and you were talking too much and you were fighting off the providers still. We couldn't get you sedated with the medications for IV conscious sedation. You need something a little stronger because you're a rambunctious person. You don't want to go to bed. This is where a dental anesthesiologist, that's a dentist who has had advanced training in a residency after dental school, dental anesthesiologist, a nurse anesthetist, right? That's all they do is anesthesia. These are specialized nurses that their whole world is anesthesia, or an MD, medical doctor, trained as an anesthesiologist, same thing. All they do is anesthesiology for various surgical procedures. Or an oral surgeon. That's a dentist who has gone to an additional 5 or 6 year residency. They're trained to sedate patients, general anesthesia. Basically, someone with highly specialized training is going to be involved to turn off your conscious brain while people fiddle around with your teeth. They're going to knock you out the way mama said, and then you're going to wake up with a very different mouth. But this is great because it pretty well takes the fear out of the situation, right? Your brain is not going to be thinking about dentistry. You know, it's going to be turned off. So this is not the most common form of sedation in a dental office, but it absolutely can be done if you need it. Obviously, because of the amount of training and expertise that is involved in this level of sedation, it's more expensive. Like, there's no way around that, right? You're paying one medical provider to knock your brain out and keep you alive, and you're paying a completely separate medical provider to do all of the actual dental procedures on you, right? So you're paying two different people to do two different difficult jobs. It's more expensive. That's just how it is. Again, that's why on my channel I try to teach people how to never have dental problems so that you don't get in a situation where you have to have this big sedation appointment and have your whole mouth reconstructed. We can absolutely do that if it's necessary, but it's very expensive and it's very difficult to get those costs down because it's very hard to do, right? So I'd rather you just not have to go through that and not have to pay for that, which is why other YouTube videos. But yes, but if you need it, general anesthesia, really great treatment option for some patients, just totally takes the fear out of it. You go in the office, you're out of the office, you don't even realize anything happened. Voila. So hopefully all of that's making sense. You have a better idea of what your options are if you are a patient with dental anxiety, a lot of dental fear. I talk to a lot of patients who come into a dental appointment and they think that they're getting same-day treatment with dental sedation, like they're just coming in. They're like, I talked on the phone and this is what I want done and let's just do it right now. That's not how it works. I really don't recommend that be how it works either. I know if you're a patient who's very dentally anxious and fearful that you don't want to spend 1 second inside of a dental office, that you don't have to, but you still do need to do that front end work. You know, you need to be doing a consultation with your provider to figure out, okay, what's going to be the right treatment plan for you? What's the right level of sedation for you? We've got to go over medical history. Like, you don't want to skip any of these steps. You're using that consultation as an opportunity to make sure that, okay, I'm comfortable with the people who are going to be working on me and helping me through this process. You know, there's this tendency in modern healthcare, and I think in part because of the way that a lot of this stuff is advertised in various ways, that people think it's just been commodified, where people think that they can just show up at a dental office, get knocked out, and have a brand new set of teeth, like it's just driving through a drive-through at a fast food restaurant. I don't recommend that. Like, I don't really recommend working with a dentist who's like, oh yeah, we'll do that. Come on in, sit on down, let's knock you out, let's do it right now. It's like, there's things you need to be aware of and planning and just what are the limitations of what's going to happen and what to expect. You want to have those conversations. You don't want to just jump in and do something. And I understand emotionally you feel like that's a good idea because you're like, I just don't even want to think about this. I just want something to happen and be done with it. You're going to have to think about a few things to just make sure that you're making an informed choice about what you're having done from a treatment perspective. Again, you know, that's just my opinion. You know, you don't have to agree with my opinion, but just based on things I've seen and heard and situations I've come across, you want to make sure, even though you're scared, that you do your due diligence in understanding what your treatment plan is, what it's going to be like when you have that treatment done, setting appropriate expectations. That's important. You actually just made some progress in overcoming your dental anxiety. Did you know that, right? If you watch this whole video, you just voluntarily exposed yourself to the thing you're the most afraid of. That's step one of, cognitive behavioral exposure therapy or whatever, right? I'm not a psychologist, but that's basically what it is. The idea is, like, if you want to overcome a fear, you have to voluntarily expose yourself to the scary aspects of that fear, realize that they're not going to harm you as much as you think they are, and then you can take a step forward and make progress toward reaching your goals that fear is trying to stand in the way of, right? Start building that confidence, being able to push past your fears. That's kind of how I'm viewing these YouTube videos, is that they're a way to help patients who are unlikely to step foot in a dental office to overcome some of these limitations and fears and things, obstacles I've just seen that stop people from getting their dental health to the point that they want it to be, right? I want to help patients feel more confident and competent when it comes to oral health care. And I think that can be accomplished on YouTube honestly better than it can be in a dental office. I just think that's absolutely true. You can reach so many more people, and I can take my time talking to you in ways that I just never could in a dental office. Don't you want to be confident and competent about your oral health? Doesn't that sound like a worthwhile goal? Shout it from the rooftops. I want to be confident and competent about my oral health. All together now, come on, join in. I'm step 1 of exposure therapy for fearful dental patients. That's the way I'm seeing this. Boo! Did I scare you? I'm sorry. If you want more information to help dentistry be a little less scary, a little less intimidating, more tips on how to take care of your teeth, take care of your oral health at home without the help of a dentist like me, so you can save time, money, scary experiences at a dental office, make all of those things less intimidating, less scary, check out my dental health tips on my YouTube channel. I've got a playlist, dental health tips. You can pick which videos are relevant to you. Truly, you are more powerful than you think. Your ability to prevent problems at home is greater than my ability to fix them at a dental office. That's just cold, hard facts. It just is. I believe that. I think that's very true. And I need to convince people of that, or we're going to continue to have a lot of people that have a lot of dental health problems that are hard to fix. Like I had a patient who called on our emergency line a while ago, and I was talking to him, high anxiety patient, and he was asking me about sedation, and I was like, well, there's different sedation options. He thought that in some cases dentists didn't even get patients numb. He's like, well, if I don't pay for sedation, I mean, you're still gonna does that mean I'm not gonna be numb when you work on it? And I'm just like, how bad is the public perception of dentists that they're like, we don't even numb your tooth, we just work on it while it's in the most pain if you don't pay us extra money or whatever. It's just, there's definitely a communication gap between the public and dentists that I'm trying to help address, because there's just a lot of fear and misunderstanding. The idea that any dentist would be like, I want to not numb this patient because they didn't pay me enough, so I'm going to work on their tooth and make it hurt. That sucks that people think that stuff, but those fears are real. That's, some people just don't know any better. He wasn't mean to me or anything. We were just having this conversation on the phone, and he was just legitimately scared that I was going to work on his tooth without getting him numb. And, and admittedly, dentists like me personally, definitely responsible for some of this poor public perception of dentists. I've definitely failed to live up to my own expectations in, the way I interact with patients in a dental office from time to time. Sometimes just fear and anxiety and pain and all these things can make things run a little too hot emotionally in a dental office. And, yeah, I've had some moments I'm not proud of, in the way I've talked to patients sometimes. Also, historically, dentists used to do some crazy things. There was this thing that used to be taught called hand over mouth technique. This was if a kid at a dental appointment started, yelling or screaming or acting up or whatever, you were told this was your training, to take your hand and cover the child's mouth. Wow, yeah. Everything I now know about giving patients control and helping them to understand what's going on. No, we're just gonna take our hand, we're gonna cover your mouth, and you're gonna shut up and do it. Crazy. And you're like, I wonder why people are scared of the dentist for life. I don't know, because I was in a bunch of pain and some creepy stranger put his hand over my mouth. Yikes. So historically, dentistry has done some crazy things. There's a reason the public fear perception is out there. But if you're a parent watching this, you don't need to be horrified. Dentists don't do this anymore. It is not taught anymore. We don't do this. Also, if you want to help your child so that they don't have dental health problems, on that dental health tips playlist, there's a video for parents. There's a video for pregnant women. Check those videos out. Just some good tips on how to set your kids up for a healthy life from a dental perspective. Also, I figure there might end up being some dentists, hygienists, dental assistants, dental auxiliary staff that end up watching this video. Office managers, front desk staff, anybody who works in a dental office I think could benefit from reading the article. I'm going to link in the video description. It's an excellent article from the Australian Dental Journal. I'm going to link that in the video description. This was an article among many other resources that helped me really understand better how to help patients with dental anxiety, to just have a smoother experience at a dental office. Helped me a lot. It's really improved my ability to work with these patients. So I would really highly recommend that to anyone involved in the dental field who wants to understand how to alleviate patients' fears and make them more comfortable in the dental office. Because, again, personally, so much of the way I have approached most of my life has been very logical, has been based on verbal information, very explicit information, and I've just had to come to grips with the fact that so much of dentistry is emotional, and it's nonverbal cues, it's body language. People are not going to tell you verbally what they're thinking when they're scared a lot of the time. They just don't. They just won't. I wish they would, but they won't. And so you've got to be able to read into things, and then you've got to bring stuff up. You've got to be like, is this what you're feeling? Are you having? And sometimes they'll clam up on you and they don't want to talk about it, and that's okay. But a lot of times, if you break the ice, they'll open up and they'll be like, yes, I can't do this because of this bad experience, and can we try this? And blah, 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 blah. It all comes spilling out. But you've got to be able to pay attention to what's going on with somebody to be able to start those conversations a lot of the time. If you're a new dentist or you're new in the dental field in some other position and you're like, man, I'm really just having a hard time connecting with patients or understanding what's going on, check out that article. Just read up on emotional intelligence stuff, body language stuff. It can help you a lot in dentistry. Might save your butt. All right, that feels like all I needed to say. Are you feeling sedated yet? Did I bore you enough to put you to sleep with this video? If you want something more interesting, you can go watch some of my clips of my stand-up over on my YouTube channel. I do stand-up comedy. That's something I really enjoyed. Been making a bunch of weird little TikToks. I'm in the TikTok game. Nobody wants me there, but I'm there. Please subscribe, click all the like buttons and things. Offer your household pets up as a sacrifice to the YouTube gods and the airplanes in my honor. That would be appreciated. Leave a comment, troll me, tell me how I should just give up and jump off a bridge. I'm not going to listen to you because I'm silly like that. I'm going to keep doing my stuff, but I appreciate the input. Have a good day, everybody. I think that's it. Another airplane. It's a lot of airplanes today. It's gonna be weird if none of you can hear the airplanes and I keep doing this little airplane thing and there's no airplane sound in the background. Anyway, go away, airplane. Go away! Just shouting at the sky. Okay, whip it good. Now we're hearing geese. Are you hearing the geese? Ha-ha! 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 I can make noises at you too, goose. Up in the sky. I don't know if you can hear this right now, but I can hear it. It's an airplane. So, don't whip your whippets while doing whippets. Whip it good. Whip it. Well, there's a plane going overhead right now, so I'm not going to try to record the video because of the plane. There's been a lot of trucks driving by today too, garbage trucks. Somebody out here was cutting the grass. That was annoying. I need to get a soundproof room.